देवबरोबर ब्रेस्तार देवमोगाच्या कोकणी भाषेतली नेकेत्र या कार्यक्रमाचा आज ब्रेस्तार एक नो ब्रेस्तार आणि आमच्यामध्ये एक लत्त लत्त जेवण आहे ताका हिंग तुळी चांगला अर्थ आहे ना पण म्हळ्यार एक एक तरणाटो एक पिको पिको तवशाबरी आलो एकलो तरणाटो आमच्यामध्ये आसा आनीक तो खाली आसा मात नाही he was made in foreign and brought to India and properly managing a big institution तो आयल्या उपरांत थंय जाल्लें सुदारण कितलें आनी हाव इंटरॅक्शन विथ द पब्लीक म्हणलें आमकां कळीत आसा जर्नलिस्टांक त्या देखून ही इज द रायट पर्सन टू सीट ॲज ए कोंकणी भाशेंतल्या नेकेत्रा कार्यक्रमांत त्या देखून ताका आपण हाडला आमच्या मध्ये आसा रोहन मोनीस शिरवांगार म्हळ्यार गोत्ता कळ्यांगार म्हळ्यार गोत्ता परंबळ एक मनीस तितलें मात न्हय कोडयाळान तो कणाचूर हॉस्पिटल्स अँड रिसर्च सेंटर आनी तांच्या सगळ्या वेवस्थेचो एक PR एडमिनिस्ट्रेटीव हेड जावन आसा सगळ्यांच्या हायेस्ट टॉपर आसा कणाचूर मोनू आमकां कळीत आसा तो मॅनेजमेंटांत कोणूय मुखार येता जाल्यार तांकां बरो अवकाश दिवचो मनीस आनी ह्या मनशाक रायटली दे गेव हे ऑपॉर्च्युनिटी आमचे मदें रोहन मोनीस आसा एक डॉक्टर वैद्य डॉक्टर म्हळ्यार आमच्या मध्ये फेक डॉक्टर PhD डॉक्टर आनीक मेडिकल डॉक्टर म्हणून आसात वो मेडिकल डॉक्टर तांच्या मध्ये ह्या तिना मध्ये वो मेडिकल डॉक्टर आनीक डॉक्टर जावन एक हॉस्पिटल आनी रिसर्च सेंटर बारी परफेक्ट रितीन मॅनेज करचें आसा आज ताका स्वागत करूंक कोंकणी भाशेंतल्यान नेकेत्र म्हणून म्हाका हें भोगता आज स्वागत रोहन मोनीस तुका
थँक्यू रे मॅडम
तूं हांवें अशें बक्का रबळे बेडीन फॉरेन बेजार करनाका सांग खंय जल्मलो ही कसो धाकटेर मुसर जालो म्हणून सांग मागीर उरलें मागीर उलया
वय हांव एक्चुअली जल्मलो 1979 22 नोव्हेंबरांत आनी
परत जावन गेलें
वय
कांय तरी करी तेका
परत जावन गेलें वय एंड आई वॉज बॉर्न इन मणिपाल हॉस्पिटल मणिपाल अंत सो पप्पा म्हजो एक्चुअली फ्रॉम शिरवा मंचकल टावन ते गांव आसा पालमे म्हूण थंय वस्ती करनासलो आनी पालमे इट्स व्हेरी क्लोज टू शिरवा मंचकल तेंच लागीं जावन आहलें आनी मम्मी फ्रॉम मुद्रंगडी वय मुद्रंगडी वय सो
मुद्रंगडी केंज म्हणटात
वय इट वॉज कॉल्ड केन्या तेला KENJAR म्हणून सांगून आहलें वय फादर फ्रांसीस लुईस आहलो वय he actually
PRO of Mangalore to pehle eka gala
he is the one who baptized my children also we've got a lot of respect for Father Lewis so I was born in Manipal Hospital tei mangir kaltana I had my basic schooling done in Dubai why papa Dubai in kaam karna lata papa chena
Dubai
no proper Dubai we lived in a place called Karama Karama ravana lata so papa chena
normally par Dubai mala ek junction then
yes so papa chena Mr. Andrew Monis and mummy chena Eliza Mendonça why so he was working in Dubai they kaam karna lata he was working for a firm called Jotun Paints where he was heading one of the transport divisions things down alate basic education till the 9th standard 10th zalle mujhe so apart from education I was into sports I was into basketball I was into music I was out the altar burgo is on allo they way at Dubai church St Mary's church Dubai nalat
ani tumka St Mary's church
way amka St Mary's church alle so way so it was initial growth anle my 10th standard kaladale we had to move to India. So 10th standard and I was at Little Rock Indian School.
Tu matra.
Ne aao muzo bau muji boin. I have got a younger brother. I've got a younger brother. His name is Russell Monis. So presently ata he is at San Ramon.
Russell ka hi maal laga the Russell Monis thoda.
Zangpur papa gadi sari.
So Russell ka hi station aane.
Yeah, it's an Emirates. See, UAE has got 7 Emirates. So that's one of the Emirates. So Russell presently is to Poisas. He's in California. He's at San Ramon, California with his wife and child. Anik Boinasalan. So she is a dentist and she is presently living and working at Manipal. So तो आम्ही पूरा पटी आले. So what happened was I got lucky being the eldest. म्हाका Little Rock and खाली एक कोर्स मेळ्ळें. So it was a total U-turn.
Little Rock agat gela.
Yes.
As a bunch.
Yes, okay. As a bunch, as a gang of the Monis, whatever. The first Monis clan.
Pura Monis
tenth gele puri why. So ami angalat. So what is happening is amche actually we were like initially we were out of place because I was for the first time in a hostel setup.
Out of water.
ओय फिश आउट ऑफ वॉट
हांव व्हडून तुका अशें तमाशान सांगतलो तुमी ते काही दुबयांत काय पिझ्झा बर्गर KFC आनी पुरा खावन तुमचे थंय त्या दळा ते अंगडी स्टार्ट जावन वतल्यो काही
नाही नाही
लिटल रॉका कडेन कांय नासल्यो
इम्पॉसिबल
हाव यू लिव
it was like a hard
भितर दवरले
it was like a hardcore rural area
I
and
know.
jonk everything was super disciplined super disciplined time morning prayer liner roche jonche khaunche playing time bathing time and for the first time in the boys hostel and for the first time in a co-education environment because Dubai we were in the boys school and my sister used to go to a girls school
ते time सांगले समाधान अंदर fish out of water
yeah initially so the adjustment timings so sumar zale I think my brother and sister shawarma na roasted chicken
Iranian shawarma
hummus na labanap na I mean we had a lot of kind of different kind of work and life happening
mummy daddy padi tala cool tala
it was probably a requirement it was a plan by dad you know probably for higher education anga move down kalimuni karong and you know Dubai he was also planning to wind up slowly te shekan so te challe so but you know the conversion was so much because आम्ही actually गावात येताना मुजी आता तुम्ही सांगता कोंकणी भाषेतली म्हणलं आमची भास तितली बरी नासली वी कुड ओनली स्पीक इंग्लिश आनी हिंदी कोंकणी इल्ली येताली तो मक्कर करतना गावाक वतना काले येल्ला बर्रा किफालक झेन so when we used to go to the village what used to happen was आमची मालगडी आमची शेजारी पुराली लायक आमकां मक्कर करचे कशें म्हणल्यार ए रोहन तूं मोनीस की तूं दुकोर
तुका दुकर म्हळ्यार
दुकोर म्हणून म्हाका काले म्हणून गुत्तू ना आतां गुत्ता काले म्हणजे
आतां म्हळ्यार सांगीत
आतां सांगीत बरें केन्ना हांवें सांगचें मोनीस बारीक सिरियसली म्हण सांगून मोनीस वय म्हण लायक न्ही तूं मोनीस की दुकोर ताणी हांसचें ओमतें पडचें पुरा सांगून आहलें so this was the
they are mocking you
it was a fun time not like a very crude mock or something but ata okay thanks to the profession thanks to moving down to Mangalore thanks to the family I mean no now I can speak Konkani I can do Kannada I can do Tulu apart from English and Hindi I picked up Malayalam I picked up Telugu also so you know
that is a professional touch
that's a professional touch and in terms of social communication in terms of medical communication आमी इल्ले सक्सेसफूल जाल्यात आमी इतले पुरो आतां भाशे उलोवंत so 11th जाले उपरांत so 10th जाले उपरांत I was for 11th and 12th at Shirva I was there for the school so St. Mary's school so dad said नाका आनी हॉस्टेल आमचे घर ना तूं घरात नोस आमचे घर थंय मस्त लागी आसलें so we used to go to the school 11th and 12th it was another waking up experience because I mean the facilities and pura were a little bit on the lower side
abani odli mai allingi
ab natlo odli mai alli odli mai her name was Mrs. Florin Monis tika pula ban mana pon challe
that is very nice experience
yes I mean I think she loved me a lot maka kale I mean she used to call me Shannu to maka Shannu mular tika zaiji Shannu ai logi okay randun kalche Shannu ai logi ye karche Shannu ai te karche illo mustu mogallo
she might have felt that tumka te inta naanne te hostel an dorle amale tika te
जाऊं की परो but I was also like you know maka ille 4-5 friends allat ame gara apun atche there was a time when I slowly started coming home alone tine sar chale Shanu तुझे ईस्ट के गेला किती काढून नाही पुढे घरातना she always loved to me to be with my friend circles for some reason I think she was a wonderful soul to be very frank that way ते शाळेत so 11 12 झाले की we had amazing experiences
एक ब्रेक कर घ्या
definitely yes
कोकणी भाषेतले एकत्र या कार्यक्रमाचा आमच्यामध्ये असा रोहन मोनिस आणि तो हितलो फर्स्ट क्लास तुम्ही ऐकले असले कणचूर इन्स्टिट्यूटाचो एडमिनिस्ट्रेटिव्ह हेड जावन आसा आमच्या सांगात आसा तो आनी हे 2-3 सेक्शन राव आमच्या सांगात पळय आमी कोंकणी भाशेंतले घेता एक ब्रेक काण घेता राव आमच्या सांगात स्वागत मग जन कोंकणी भाषेतले नेकेत्र या कार्यक्रमाचा आमच्यामध्ये असा रोहन मोनिस आणि डॉक्टर रोहन मोनिस MBBS आणि तो कणाचूर इन्स्टिट्यूटाचो एडमिनिस्ट्रेटिव्ह हेड जावन आसा त्या देखून तो हांगासर आसा आनी तो आयल्या उपरांत तांच्या इंस्टिट्यूटाक कितें बदलावण जाली एज ए जर्नलिस्ट म्हाका बरें कळीत आसा देखून ताका ही इज अ रायट पर्सन टू सीट एज ए कोंकणी भाशेंतल्यान नेकेथे जावन आज बसोंक तो एक रायट पर्सन आनीक तो बेजीक तो कशें आमचे बर्गर गिर्गर आसतना कशें दीस काडले म्हण सांगता तो गलपताले जे वस्तूचे म्हाका परिचय देखून भुरगे हांगा येवन कशें जियेता देखून म्हाका गोत्ता देखून हांवें तें पळय सांगा ताच्या उपरांत PUC जाल्या उपरांत खंय केलें
PUC जाल्या उपरांत देन वी हॅव दीस आमचे those times we had the CET exam, Karnataka CET exam.
Branded.
So
common entrance test.
Common entrance test alle Karnataka. So I had given the CET exam. CET exam दिवन चे पयले कालन जालें म्हाका. Actually I got an engineering seat in Manipal. So ते almost जालें engineering seat. CET चे तितलें कांय आमी मोन घालूं ना. मागीर CET येताना पापान सांगलें that अरे रे तुका मेडिकल कॉलेज सीट हे पटी जाता या उठ या म्हण. आमी सांगलें डॅड वय तशेंच तूं पप्पा वॉज लायक न्ही डॅडाचे फ्रँकली सांगलें डॅडाचे फोकस जाल्यार आका डॉक्टर करिजेत म्हण. In studies, I was pretty good in studies, education-wise, in terms of activities, in terms of music, in terms of sports, and सगळं नालो. Yeah, I was doing it. So we said, you'd become a doctor, man. It was his dream also. Marks was very good. So then I said, okay, fine, let's go for the CET, man. Then I was lucky to get. So I got a seat in KMC Mangalore. So that day I still remember very well. So we were at Bangalore. Tani ocean dawlo table over hath gan sali KMC. I say alla sir nintkoli solpa sir kutkoli eshekan kutanchi greet asa mon KMC madle. Then we came out of the streets and my dad's elder brother who is Colonel John Baptist Monis, he lives in Bangalore. Muzo bape road वरती बांगडा करना सा नासो नासा. He's very happy. Okay, seat zali mainly mainly. So what is happening is then the question was coming.
The year?
This was I was in the batch of 1997. I'm admission alway. So what is happening is people used to keep asking at तुम्हारे आंध्रू ना मगे कुंदु NRI seat किधर निकालना. I'm saying no, it's not an NRC, it was a hardcore merit seat.
नहीं तू कहीं insult
insult see what is happening, that is a different way of people inquiring कच्चे दूसरे तीसरा था ऐसे मन. As it was a hardcore merit seat and yes, it was in the payment quota. Fees was around I think 50,000 and went to 70,000. So my five and a half years there was amazing. I think that is the phase of metamorphosis. When somebody comes out of the cocoon, exposure, because I was left to all by myself, firstly. Secondly, amche family koni doctor natlet. So that term of family guidance natle. So we had to pick it up from my seniors or from my batchmates or from my peer groups. So did pretty well there. I've completed with very good scores. Apart from that, I was also into extracurricular activities. I was leading the KMC. We had a music band, college band. I think we have won town level, district level, state level, national level competitions in music on the first place. We've done that. Into art, into Pictionary. No, this what happened is, music starts. Dubai was karta. So dad was had this thing of into entrepreneurship also. So he started a music school also. He started a music school and I did my basic 2-3 years of training into music. So I have also been trained, certified by the Trinity College of London. I've given 2 grades in theory and practical. Yeah, Dhoni, we've topped those schools also. This is all. So all these experiences added on. It was a lot of hard work, a lot of focus. So KMC time was brilliant, to be very frank. And at the KMC Nastakale, one thing was very unique. Nobody used to know me as Rohan. Everybody used to know me only as Monis. As he like what I'm senior professor Rastad. Monis, Monis, come sit down, Monis. Surname, it was not a culture or something, but somehow this Monis stuck onto people's head.
Not that. It's a smaller word, so easily.
That could have been the thing, And I think we had wonderful seniors. And the first time I went on stage in KMC was, I think, in March 1998. It was the graduation day of, I think, 91 batch or something. Phenomenal. It was on the stage. I was playing with my seniors. I was in the college band. So they experienced a Suru zone, and it was brilliant. That helped me out. KMC Zalupram, what happened was I worked for a couple of years in Mangalore in a hospital. Then I picked up my fellowship in critical care. So this was something which I had to think about.
Critical care,
intensive care medicine. or you talk about critical care physician. So I did my training or a fellowship program at Apollo Hospitals in Hyderabad, which is presently called Hyderabad, yeah, Apollo Health City. Well, it was not an easy move because Chintana first is like, okay, fine, gaon dusro, koso astalo, lo koso astalo, kaam ke astale. But critical care is like, jumping from the pan into the fire.
Oh.
Like, it is more, you have to be on your toes.
Why?
And occupation related hazard sumar asate because need podana, jonk, zaina, sama, yente purasta. But the skill you attain is par excellence, to be very frank. And it was a very labor intensive similar. Our ICUs are always full. Exposure was tremendous. And I will recommend doctors yes, we have to become, we need a lot of doctors in the society today because there's a lot of people, we need a lot of care, we need humane doctors, secondly. Thirdly, we need doctors with a lot of skill. They should have that art of communication, that art of humanity with them. Thirdly, skill set. Skill set is very, very important. Trying
common
to
sense apply skill set.
Yes, sir. Yes, sir. Common sense, this, because what happens is to be a complete physician, it's easy na, askal. But what is happening, because we have a lot of distractions these days. Ami shikta na amka mobile natle, amka title, kai online, kai craze natle.
Google and bolon treat karche natle.
We had only books. Ata now you have a lot of information.
Books and brains.
Books and brains. Now you have a lot of information. But you have to direct your brain on what information to choose.
Ani patient agi Google and search
yes. Nowadays patients are also very smart, very demanding. They are always updated. So you have to also be abreast with the situation. And you should help them with the best. And now, right now, everything is like micro management into medicine. Amazing specialties have come. Mangalore has become a very good destination for healthcare right now, and it is just expanding. Fantastic skill set is available in town. So that became one thing. Then I became a junior consultant in critical care. At Apollo Health City, Hyderabad. Apollo Health City, I had the benefit of being a part of the first health city of Asia. So Apollo Health City, and we were the first unit in the world to be JCI certified for stroke. Now, stroke JCI mutana, it's a quality management pathway. So I was the JCI doctor for neuro ICU also. I was a neuro ICU JCI doctor. Tanto astana lot of effort, lot of work, and simultaneously also I was doing an MBA program. I was MBA shikon allo, yein karnallo, kame karnallo, ICU. So those 2 years I really maybe 3 times or cheated my life and my span pura. Where se kal dalna. But it was something I use called as mind over matter. I'm sure, like with focus, with hard work, and this phrase mind over matter, if you concentrate on that, I think nothing is impossible. Fix control. So you have to plan your sleeping time, your jonche time, kitla vara kaam karta hai, keshe kale shikta hai, how will you give your energy to that focus, that vertical. So it was, those 2 years was tremendous, and I learnt a lot.
Dad was expecting you like that.
No. See, Papa's thing was like always that I will retain myself into the medical field and not drift towards the administrative side. To be very frank, yeah. But what is happening is, but Dad could not see me. Ami kalen kaam karta tha, ami keshen kaam karta kalen. Because intensive care is not a job. Because now ICU nastana, they are not our loved ones. They anikona chimogache. Tanka where kadije zaler, tanche systems management kurum zaler. Now somebody comes, we were in the neuro ICU, he comes with a stroke, brain program, kalta kal zaler. But heart samana, lung samana, tanche port samana, tanche liver samana, te pura manage kar mukar hotana. It is not an easy task, but it was a fun task. But simultaneously to tell the beneficiary or tell the family of the loved one saying that I'm sorry, golosikasa, makacha, the surd, respond less low asa. So that was a bit of a catchy moment. So thanks to JCI, thanks to this administrative control in the hospital, in the ICU per se, I enjoyed.
Administrative control of Zraila.
Administrative control sir, I like that. Yeah.
To be next Kanachur goje.
Next,
एक ब्रेक काढ घ्या. कोंकणी भाषेतले कार्यक्रम असा आमच्या मध्ये असा रोहन मोनिस आता कणाचुरात असा. पण पहिले तो किती MBBS डॉक्टर किती गेले साहेब तुम्ही ऐकलंय राव आमच्या सांगता कणाचुरा विषयी ऐकून मस्त असा तो किती त्याच्या डॅडीच्या एगेस्ट कणाचुराचा ॲडमिनिस्ट्रेटिव्ह लेवलांत ऐका पळया V4 न्यूज कोंकणी भाषेतले एकत्र एक ब्रेक काढ घ्या. स्वागत मग कोंकणी भाषेन नेकेत्र ह्या कार्यक्रमाचा आमच्या मध्ये असा डॉक्टर रोहन मोनिस आणि कणचूर असो ॲडमिनिस्ट्रेटिव्ह हेड तो जावन आसा डॉक्टर जावन एक MBA कर MBA कर देन कणचूर असो ॲडमिनिस्ट्रेटिव्ह हेड जाला तो आयल्या उपरांत थंय PR इतलें चड जालां की म्हाका दिसता काय इट्स ए व्हेरी गुड एसेस टू द हॉस्पिटल अँड रिसर्च सेंटर तांचें तें बरें जालां त्या देखून कणचुराच्या विशयान कितें आसा कितें ना कितें करतात म्हणून एक कडेन सांगून सोड.
So Kanachur Hospital संस्थेक हांव जॉइन जालो 2014 2014 March April join जालो हांव. So आज वर्सा कालन जालां म्हणून so we built up the hospital. So I had a very unique opportunity to be with the founding team. The founding team, the chairman of the Kanachur Education Trust is Haji UK Monu sir. So he's a senior person in Mangalore, and I think he's a very famous person, very respected person. He's a very strong person, and he's got a good authority, good hold over things. And his son, Mr. Abdul Rahman. Mr. Abdul Rahman is the director of the trust, and so Abdul Rahman was a friend also for quite a few years, and his family knows my family. So what is happening is Rahman and Sangle like Papa's project जाते हैं healthcare project. He wants to talk to you. Same was muzo malgodo put zalmallo actually. My elder son was born. So I said okay, I'll talk to chairman sir. ಉಳಿತನ ಚೇರ್ಮನ್ ಸರ್ ಸಂಗ್ಲೆ ನಾನೊಂದು ಹೊಸ ಪ್ರಾಜೆಕ್ಟ್ ಮಾಡ್ತಾ ಇದ್ದೇನೆ ಹೆಲ್ತ್ ಕೇರ್ ಪ್ರಾಜೆಕ್ಟ್ ರೋನ್ ನೀವು ಬರಬೇಕು ಆಯ್ತು. ಐ ಸೆಡ್ ಓಕೆ ಸರ್ ಐ ಆಮ್ ಗೋಯಿಂಗ್ ಟು ಜಾಯ್ನ್ ಯು. ಸೊ ಜಾಯ್ನ್ ಜತಾನ. ಸೊ ವಿ ಬಿಲ್ಟ್ ಅಪ್ ಅ ಹಾಸ್ಪಿಟಲ್ ಫ್ರಮ್ ಗ್ರೌಂಡ್ ಝೀರೋ. ಪ್ರೆಸೆಂಟ್ಲಿ ದ ಹಾಸ್ಪಿಟಲ್ ಇಸ್ ಅ 10-story building and name the specialities, pura specialities are set. But that campus we are providing education because it's a health education hub right now that we plan to create. Medical sciences, MBBS, we have a nursing college. We have a college for physiotherapy or physical therapy. Then we have paramedical colleges which come under which come optometry. Then we have medical lab technology. Now we've also starting radiology technology and dialysis technology and OT technology. So now these courses are starting. Close to around 1,800 students are there in the campus as we speak today. So from 2016, as Mono sir, continuous batches yevunu tasat. The college has been expanding in terms of services, in terms of student load, in terms of faculty, and it's been doing a tremendous job. At the hospital, Kalipur, facilities are set for the people. For the people.
Student are pura hostelites.
Yeah. No, what is happening? Hostels are set in the campus. So what is happening is localized students ko na set. Local muller, the Rajiv Gandhi University, which the institute reports to, they say at a radius of 15 to 20 kilometers kon router, they will be considered as localites. Outside students will not be considered as localites because their proof of address is very important. Hostel capacity is there, very good hostel facilities and food has been provided. At the hospital in Polelar, since we started build the hospital, we've got a full-fledged emergency department of radiology, and the critical care, ICU. These departments run 24/7. We have a very good department for labor, that means delivery. Okay. So a lot of ladies come there. See, the advantage of this situation is of this institute or this hospital or this healthcare unit, Kalamular, it is now close to an 800-bedded unit. 800-bedded unit bandu nadunk, it's not an easy matter.
Why?
Secondly, we have continuous affiliations with the Medical Council of India, which is presently called the National Medical Commission. And the students yonastat, not NACNE, it's called NMC. NMCY. So this is happening. Simultaneously, we have a blood bank. So when we start a blood bank, when we start an ICU, we talk about facilities, we talk about infrastructure. At the blood bank was a component therapy blood bank. Component therapy, you have whole blood and component. You have PRBCs, platelet component therapy, pura separation cell. So all these machines were bought and put. Operation theatre Montana, we have about 10 operation theatres today as we speak. Ultra modern operation theatres. Girls potta, Zai potta. And we have, apart from the basic specialities, we talk about medicine, surgery, obstetrics and gynecology, ophthalmology and all. We also have neurosurgery, we have thoracic surgery, we have got hand microvascular and hand surgeries we are doing orthopedics. Under orthopedics we have like replacement clinic, joint replacement clinic, we are talking about onco clinics. So we have beautiful work. Apart from that, we have got a spine center, we've got urology, we've got nephrology, we've got endocrinology. आता एक भाग आता सर्ट जावन आसा. We've also got rheumatology division. So आता लोकांक कितले लोकांक हे पुरा कळीत आसा ते येतात, कोणाक कळीत ना ते इसार नेतात या कॉल करून येतात. नाव आमचे हॉस्पिटल व्हेरी सिंपल म्हणल्यार काय म्हणून जातात, लायक you can enter the hospital, maybe the OP ticket just costs you 10 rupees. Consultation fees is 0. Admission gars aslar, admission cost is 0. Bed charge is 0. Doctor charge is 0. Nursing cost is 0. Even we give 4 meals a day, it is given free by the institute. This is exclusively for patients in the general ward.
4 meals pula kasha?
You have a morning breakfast, then you have lunch, then you have evening tea, coffee asta, manje ratiche dinner asta. Yeah, we give you healthy, nutritious food. So the same food what the students are having in their messes, because we've got a fully mechanized or automated kitchen, the same food even these patients will have. That's how it is. And I think the way it is unfolded in the last so many years, it has been a lot of hard work, a lot of sleepless nights, lot of planning, lot of mentorship, lot of delegation, and we've got a good team in the hospital. Like today we had a couple of interesting surgeries to happen. Very soon we will come front and talk to people about it. And now the preparation behind surgeries is not easy. One other department which I want to talk about is the department of craniofacial anomalies. Ata konache sondi samana, or they have a cleft lip, or they have a cleft palate, or they have like facial anomalies. We have got a dedicated institute for that. Okay, so we have got Mustafa Ahmad, like Dr. Yasatanto, who is handling these kind of surgeries, and you will be amazed by the work we are doing. So, and we have patients not only from Mangalore region, we have patients coming all the way from Kerala, from Uttar Kannada districts, from Shimoga, Hassan, Sudun Netiyat, Isar Netiyat. Now what is happening is, we realize that these patients, tanka gars asa, a lot of patients are on dialysis, tanka gars asa, and it is affordable healthcare. It is subsidized healthcare. Yeah.
So facility it is nearly zero.
Yes. So what is happening is, even for me personally speaking, I trust the system so much that my second baby, when she was born at Kanachur hospital, to be very frank, because the baby was a big baby. We had to do a cesarean section. So my daughter Rian was operated on, my wife Smita was operated on, the center bought it. So they said that, why Kanachur? I said, I trust the system so much. This is what we build. This is what we create. And seems that the director also had the advantage of having a son born in the same institute. Like this, there's a lot of love with the institute. There's a lot of selflessness. There's a lot of okay, and the effort gone by the trustees or the management team, especially chairman and director Haji UK Monu sir and his son Mr. Abdul Rahman, has been tremendous. Mr. Abdul Rahman, it's been tremendous. Because it's not a small task, to manage 1800, 1900 students, manage about 500-600 staff, and you manage housekeeping, you manage hostel wardens, and you manage food, and you manage. So it has become like a mini industry by itself.
And it is a beautiful coordination with the Rohan Monis.
No, I think I'm blessed to get an advantage.
We'll take a break.
Thank you so much.
कार्यक्रमाचा आमच्यामध्ये असा डॉक्टर रोहन मोनिस आमच्या कणचूर मोनू आमच्या हॉस्पिटल असो कणाचूर हॉस्पिटल असो ॲडमिनिस्ट्रेटिव्ह हेड आणि सगळ्या आस्पत्रे विशयान ताणें एक पिक्चर दिलें तुमी आयकतात आणि कितें फॅसिलिटी आयकतात आमी एक ब्रेक काडून घेता कडेच्या सेक्शना खातीर राव आमचे सगळ्या पळय बिफोर कोंकणी भाशेंतले घेतना एक ब्रेक. स्वागत मग कोंकणी भाशेन एकत्र या कार्यक्रमाचा आमच्या पदाचा रोहन मोनिस डॉक्टर रोहन मोनिस आनी ताची फॅमिली हांगासर आसा. आमी तांकां ताळयो पेट्टा कित्याक म्हळ्यार ह्या रोहनान सांगलें इतलें पुरो आयकून आमकां दिसलें तो घराके धाडयता कोण ना म्हणून. ताणें करून ताच्या फॅमिलीक सकाळचा हांगा मदें बसयलें आमी. सांग उडलता सकाळी डावट जाला आसतलो इतलें बरोबर काजर जाला की ना घेवन
काजर जावन
कोणी सैरीक सोदून जाली आसतली ताणें करून मनीस म्हाका एक काबराल घराण्यांतली एकली येजमान मेळ्ळ्या म्हणून सांग तिचें नांव सांग भुरग्याचें नांव सांग. या
Wait, my wife's name is Smita Cabral. She is an engineer with KPTCL. Tiche designation down as she's an assistant executive engineer. Current katta galta dita osa hai tapura. So it's a very interesting profile that she's running. She is heading as a nodal officer. So she's a nodal officer for Baikampardi, for Mulki, for Konaje, and her head office is at Kaur. Maka gutta, don't think office angela, they're all substations. So they give power to a lot of areas.
Station gaina.
Ani anga transformer ki battery. This fellow is Reese Declan. He is 6 years old and he is studying at St. Teresa's. He is in first standard.
Okay.
Ani ye amche lan she Rian Valen Monis. She is 4 years old.
The Monis
and she is going to Priyadarshini. Priyadarshini hotiya. She's in Mont 2. Priyadarshini.
Okay. Upper KG.
No, she's in lower KG.
Lower KG. Okay.
So yeah, so she's in Mont 2.
Okay.
So it has been.
How family helps you in your busy schedules? Family मिळली किती जायचं आहे मला काय मार नॉर्मली आम्ही किती म्हणतो फॅमिली आमका सपोर्ट केल्यानं आम्ही अचीव करूंक जाला म्हणतो नॉर्मली.
Now, to be frank, see, now I'm from the medical side. मुझे काम वाले hardcore critical care hospital नहीं पूरा. She is from a totally non-hospital background. So initially there was a lot of misunderstanding. Synchronization. It took some time to synchronize.
Misunderstanding nata. Misunderstanding.
Then what happens is because amche occupation has sumar asata. She's got her responsibilities. It was a hardcore arranged marriage. Because that's a different story. It is a hardcore arranged marriage, so it went on. Mangir, when we planned for the kids and also, actually what happened is I joined the Kanachur right after Reese was born. That's what happened. So when he's been a tiny person, we had the baby until today the institution is 6 years old.
So it's a government.
She's been also working. We've been also working, and trust me, I'll be very frank. I'm not praising my wife, but she's been handling the kids fantastically. She's doing a fine job. Kaam hi padata, ye karte hai, budagi padata. There've been days in which we have to take the kids to work because we don't have help at home. There've been days we have to leave them home alone right now. All this ups and downs. That's the life, but this is how we take it. We train these people. We talk to them. We make them understand. And so this fellow is not a problem. So he's having fun. He's a 6-year-old big boy. This is Alata.
Achamakar to big boy.
Achamakar book big boy. Don't worry, Dada. I will look after Reese.
Self-looking.
Self-looking. I said, okay, fine.
How coordinate you? The engineership and the doctorship, how it happened? Difference sounds
very bad.
No, different field and
doctor, see, this is a new secret, you got it. Okay. Kanachur how
Kanachurachi next plan what is happening is we have applied for postgraduate seats. So we're getting it almost to close to about 13 to 14 specialities. Clinical specialities and medicine, surgery, OBG, respiratory medicine, mangir ophthalmology, mangir orthopedics. So totally we are expanding about 11 clinical specialities into post graduation. So आता तांची preparation आता जाऊन आसा आणि teams आता उठूक जाऊन आसात, planning जाऊन आसा, because it's again an effort. It's a team effort. Now it's a departmental effort and it's an institutional effort. So pura जाऊन आसा and God willing देवासोय मोग आसा and there's a lot of sincere effort happening. जातलें चिंता we should get across it very easily.
तुमचे MBA शिकप कशें जालें तें? You are MBA.
MBA शिकप जालें कितें म्हणल्यार what happened was critical care जाताना मुझे fellowship degree पर जाताना so I was given some important roles into managing ICUs as a JCI doctor, that is Joint Commission International Doctor जावन आलो. So I was reporting to certain heads. I thought, okay, fine, I have MBA killer, I can be like a critical care director. तेशें एक मोतीन चिन्ह नाल्ले, तेशें चिंता पडलें.
Management level आगे जे म्हणून ना.
तेशें नात, that was not the plan. So I was thinking that, but when I was studying my MBA, So a dream like okay fine, probably tomorrow what is happening is if I become successful in my plans or in my strategies, I would be probably traveling all over India or all over the globe, giving talks, seminars, empowering people, helping people, trying to understand. And the expanse of healthcare is amazing because I have worked in different verticals. Hospital is a dedicated brick and mortar industry. Then I worked in healthcare IT, I worked in telemedicine, telehealth, e-healthcare, mobile healthcare. ये पूरा division मुझे experience आसा. We've also won an award in 2010 by Frost & Sullivan as the healthcare IT company of the year. So in my experience with the healthcare IT company, that's a different vertical by itself. Fishipur Astana, what is happening is you enjoy the profession. So do I feel bad like being being a doctor? I said no, I enjoy it. But the expanse is amazing because at the various streams I learn. Now we can talk about healthcare insurance, we can talk about teletriage, we can talk because of the COVID time, there was a factor called as telemedicine, which got stitched into it. Sumar hospitals institution started. But what is happening is we have worked in telemedicine industry ever since 2009, 2010.
Okay.
I had worked. I have got experience. Projects kelant. We went live. We did a lot of. It needs a lot of backup. It needs a lot of IT infrastructure in terms of capital inventory. But that was the experience which was phenomenal.
नाही पण आता तुम्ही आता एक नवे बडिंग डॉक्टर्स येतात या खंयचे प्रोफेशनाक येतात what is your advice, what is your message?
The advice and the message is yes, so we need people, we need doctors, we need nurses, we need technicians, we need lab technologists, we need physical therapists, and together as a team it's very powerful. There are so many gaps in the industry today. There are so many gaps in hospitals today. There are so many gaps within rural healthcare today. At the pura stitch down, there are a lot of amazing healthcare entrepreneurs or health entrepreneurs coming up with amazing ideas. Ye pura idea stitch ke na, you can see that the health going to the remotest of the person in the village or the poorest of the person. That is the wow factor. That is actually the wow factor. Amka zaije. We want people who are like I'm saying like humane, who understand healthcare, who have got the skills, who would love to give their service to mankind or humanity. Give service for about like a decade. Okay, fine. Then what happens is once you get the hold of healthcare, try to expand it. Try to create multiples of you.
Rohan Monis, Dr. Rohan Monis, हांगासर येवन कोंकणी भाशेन नेकेथ्रा ह्या कार्यक्रमांत तुमची बहु महत्वाचे कॉन्ट्रिब्युशन कितें आसा म्हणलें तुमी सांगलें. तुमकां देव बरें म्हणटा. कोंकणी भाशेंतले नेकेथ्रा ह्या कार्यक्रम एक बहु इम्पॉर्टंट कार्य आनीक लायफांत एक एका मनशाक हांगा आपण हाडचें म्हळ्यार people are really who are talented and तुमचे सांगता ते टॅलंट आसले म्हणून आय एम व्हेरी हॅपी. तुमचे मिसेस तुमच्या भुरग्यांक बरें मागता. तुमच्या लायफांत सर बरें जावन दी. तुमी आशेवचे सर सुख समाधान भलायकी आयुर आरोग्य पुराय मेळोवन दी म्हणून आशेवन हांगा आयिल्ल्या खातीर एक ल्हानशें सर्टिफिकेट दुसरें कांय आमी दिवंक जायना. तुमच्या उडासांत ही सर्टिफिकेट आसूं दी. आमच्या ह्या चॅनलाचो ओनर लक्ष्मण कुंदर आनी आमी सांगता म्हणून खंयचें कार्य काम हें तुमकां सर बरें जावन दी. तुमकां अभिवृद्धी जावन दी म्हणून मागून देव बरें म्हणटा.
थँक्यू सर. थँक्यू सर. थँक्यू.
कोंकणी भाशेंतले कितें ह्या कार्यक्रमाचो आमच्या मदें आसा डॉक्टर रोहन मोनीस आनी ताची फॅमिली. तो कनाचूर हॉस्पिटलाचो एडमिनिस्ट्रेटीव हेड जावन आसा आनी आमच्या मदें तो आसलो. ताका देव बरें म्हणटा. तुमी एक घंटो आमच्या मदें रावल्यात आनी हे कार्यक्रम आसा करूंक आमकां कुमक केली. तुमी आमचे वीक्षक आनी तुमी आमचे भोव मानाचे कोंकणी मोगी जावन आसात. तुमकां समेस्ताक देव बरें म्हणटा. हांव रेमंड करता कडेन पुरांच्या प्रेस्तारा परत मेळटा. नमस्कार.